I got coronavirus. And in this video, I'm going to be talking about what it was like, what I learned, how everything went. So, I've been covering coronavirus since the beginning. My wife and I traveled right like when everything was going down. Like literally, we were on vacation, I think, when we first heard about coronavirus, and we left. We were in the Caribbean, and we came home, and people weren't wearing masks on the airplanes or anything like that. But like days later, everything started with lockdowns and shutdowns, and it was a crazy time. And since that time, I've been covering coronavirus all the time on YouTube and on my Instagram and my Facebook, and I've interviewed people like Paul Offit and others and listened to hundreds of hours of podcasts from This Week in Virology and the Osterholm update and Public Health on Call, and I've been putting together videos and all sorts of things. So I've been like entrenched in coronavirus, and I feel like I've been trying to be an advocate for our community. We've had some things that have made our community really special when it comes to coronavirus. We were the only state that didn't lock down. We're one of the only states that hasn't imposed a mask mandate, and I've been really vocal about that. We've had some things that our governor has done that seem very counter to public health and well-being of our populace. Not only do we not have a mask mandate still, even though right now in the end of October we're fifth in the country for coronavirus, we have a surge where hospital beds are dropping. Also, we're the only state in the union that has not extended federally given money to our citizens, our tax-paying citizens, the money that we pay for food assistance. And our governor said basically he doesn't want people to get addicted to it or stuck on it. He wants people to go back to normal, which is, difficult in the midst of number 5 in the country surge when everything's going on. And so I've been vocal about that, and I've actually had patients that have left my practice because of my stance, but also how actively I've been using my platform to spread information about coronavirus and how you should wear a mask, social distance, wash your hands, do your part for the community, and also that a lot of the stuff that our state leadership is doing is really harmful to our citizens. And so I've lost patience for that, but I've been active about it. And it's been hard on our practice in different ways. Our practice has really stepped up. We've done innovative things. We've done telemedicine, which I love and hope to continue to doing even when the pandemic is over, because it's a great way to connect with families in a way that is helpful to them without having them to come to our office when they don't need to, so that we can continue to provide good care. Excuse me, I have the hiccups now. We have had drive-through flu clinics, which has been amazing, and we'll probably hopefully never go back to not doing that, where instead of having the patients come into the office, schlep the kids out of the car seats, bring them into the office, kicking, screaming, we have to clean the rooms after the flu shot, we just do it in the car, and it's amazing, and parents and families love it, and our staff loves it too. So there's been some silver linings for our practice, but it's really been a lot of Zoom meetings and a lot of in-person meetings and a lot of discussions and time, and that's been challenging too. 2 weeks ago, we were on fall break. We homeschool, and so we were on fall break as a family, and I was out of work for a few days and thought that my allergies were acting up. We went to the pumpkin patch. We were into the zoo. We were doing all sorts of activities that were socially distanced, safe. We were wearing masks and everything like that, but I thought my allergies were acting up. The next day, I was feeling a little bit off in the evening. I even told my wife I just feel a little like peckish, something like that. Like we were debating what the proper word was. And I still don't, I think it's peckish. Maybe, no, I think that means hungry. Peaked. I don't know. But we went to bed, and then I kind of had some fevers and some muscle aches and just felt really crummy overnight. I went to the office the next morning because I was still having these symptoms, and I got swabbed, and within 3 minutes, my test turned positive. We fortunately have access to the fast, rapid turnaround tests. And so I was able to find out really quickly. And right then, like a million things cascade when you get the positive result as a pediatrician, because I have to tell my patients. Fortunately, I was out of the office for a few days prior, so there weren't very many patients that I had to notify going back in time, and I didn't have to do it. Fortunately, I have fantastic staff that just said, we'll take care of this. You work on getting healthy. I had to tell my partners. I had to tell an administrator. Then you kind of have to work through the mental math, working backwards each day. Who was I around? Fortunately, we really don't do anything. We don't really see anyone at this point, and so it wasn't a lot of people that I had to say, hey, we got exposed. Now our kids play outside near the neighbors. We try and keep them social distance, so we had to tell the neighbors and just kind of have them watch. And then I just kind of feel crummy for a couple days. It felt like the influenza, like I was run down, tired, muscle aches, fevers. I took ibuprofen, I took Tylenol. Those things helped. I got more sleep. It was not a huge ordeal for me. I'm healthy. I'm young, as expected. I was at home for about 10 days following that diagnosis before I could return to work. I spent the time at home. I slept in the basement. Now, the health department said, you should isolate from your family. Well, we had been around each other for the past several days, unmasked as a family, because that's what families do. Like when you're together, you don't have to mask with the people that you live with. And so it was like, well, I'm not really sure if that will help. We already homeschool, so it's not going to affect when our kids can return to school. And it'd be really challenging for me to be like, hey guys, I'm just going to go watch Netflix in the basement for 10 days while you all do your stuff. Try not to use too much of the Wi-Fi. Like that didn't seem very plausible or nice to do to my amazing wife. And so we decided I'm going to wear masks. I'm going to around the family. I'm going to sleep in the basement, and we're going to do the best we can and just keep an eye on everyone. Now, we did get everybody tested because they all had stuffy noses. We didn't know if it was colds or COVID, and we wanted to know so that we could figure out how long we needed to stay isolated. So we got everybody, my staff again are fantastic, and they're like, yeah, just bring them over, we'll take care of them all. They did all their swabs outside. It was so much easier and more straightforward than I was expecting. Everybody did great. We got ice cream afterwards, socially distanced, masked at our home to go ice cream, so we didn't bother anybody. But everybody was negative. So it was just me that had it. And I spent the rest of the week, basically, Catherine did homeschooling with the big kids, the oldest three that homeschool. And then the two younger ones, we hung out. We did coloring, painting. We watched plenty of shows and just spent time together. And it was fine. I was even questioning the diagnosis at one point. Because as you go through this, I think there's lots of different things that you feel, and I'll talk about that in a moment. But I was questioning, do I really have it? I mean, my test was positive really quickly, but none of my family got it. I don't know of any specific exposures. I didn't have any positive exposures that I know. I know I had patients in the office that, were in the community that had it, and I think that's how I got infected. I don't know anyone else that I was around socially or outside of the office. Basically, I just have been going to work and then coming home. And so really there weren't the opportunities for outside exposures. And so I do think I got it during patient care, but I just stayed at home. We hung out, and eventually I got better. I was questioning the diagnosis, but then halfway through, about day 6 or 7, taste, smell, gone. And that's when I was like, okay, yeah, definitely. My test was positive. I've been around people that have coronavirus, and I've lost my taste and smell. I definitely have coronavirus. Fortunately, none of our kids have had any issues. It is weird to not taste food. And I came back to work, jumping ahead, I came back to work and I was like, oh yeah, I lost my taste and smell. I was expecting that everyone would be like, oh, it was gone for a day or two. Everybody has told me, I can't tell you how many people have said, oh, my taste, I lost it for 3 months, or I'm not even sure I can taste anything now still, I had it in July. So it hasn't been reassuring from that perspective. But there were lots of things that I learned from coronavirus. The main thing is how privileged I am. I have a warm bed to sleep in. I could sleep in the basement and not bother the rest of my family, because we are very privileged in the things that we have and the home that we have and everything like that. My work, my patients are fantastic, and they understood and they rescheduled. That wasn't a big deal. I have staff and my partners and physician assistants and nurse practitioners who were able to pick up the slack for me, see my patients so I didn't have to worry. Financially, we didn't have to worry, like I'm out of work, but we're privileged enough to not be like overly stressed about the days missed from work, which is something that a lot of people can't say. And I know that impacts a lot of people's decisions to get tested because then they can't work. And that puts stress on the family, and it's stress to pay the bills, keep the lights on, keep the kids fed and everything like that. Easy access to testing. We were able to get food deliveries, and we had deliveries from family and friends that left cookies and donuts and things. And, even though I couldn't taste, I had to check to make sure. Like, I wouldn't want to miss getting, a donut delivery or warm cookies or something like that and not realize that, oh, my taste actually did come back. And I missed out on that scotcheroo. So I still did enjoy the deliveries, but we got groceries delivered. Our kids love, like, waving at the Instacart people in the window. That's another privilege that we have. And then I knew if things get worse, I can go to the hospital. Right now, hospital beds are becoming more of a premium in our community because we're in the midst of this surge. But I knew that I had access if things got worse, which a lot of people in this country and around the world don't have access to. So that made me feel very privileged that I have all those things lined up for me in my favor, despite getting COVID, despite doing what I could to be an active advocate for the measures that we know that science says work, the masking, the social distancing, the limiting gatherings. I felt like, okay, I got this, and I can still learn from it. I can still help my patients. I mean, there was a lot of guilt, like guilt that I have exposed people, guilt that maybe there's something I should have done differently, or maybe I should have worn more personal protective gear while seeing patients. When it was patients that are here for well checks, I'm wearing a surgical mask. I have one right here. And my glasses, but maybe I should have been wearing an N95 or a gown or goggles on top of my glasses and things like that. Like, all those things kind of go through your head when you go through that confusion about how I could have gotten it, who could I have exposed, are there going to be other ramifications from this that I haven't thought about, or people that I've exposed, or patients that I've exposed. Frustration that it happened to, and that we're in the midst of this surge, and that things are so out of control in our community, and that they're, despite my efforts and the efforts of so many in our community to say, we got to get things under better control, we got to do more, we all need to step up and sacrifice a teeny tiny little bit so that everybody can stay safe, that we still aren't able to do that, and we have many that choose not to do that. And so that was a big frustration, and I think that just brought that to light, being sick, being stuck at home, not being able to continue to help and serve the community, and those sort of things. So those are some of the things that I've learned. Now, hopefully it's been helpful to hear my experience as a pediatrician who got coronavirus, as a father who got coronavirus. I would love to hear what you think. What questions do you have about getting coronavirus, about me getting coronavirus, or how we handled things? It was definitely a surprise, and I feel so grateful that the rest of my family has stayed safe and healthy, that we have everything that I talked about in this video. And I would love to know what you're facing right now, and if you would share in the comments below, I would love to hear that, because it's so helpful to see what other people are facing, so that I can continue to craft a message to provide good information that helps those that are in the midst of all of this difficulty and uncertainty that comes along with this. Fortunately, I have recovered. I am doing fine. My energy level is back to where it was. My sense of taste and smell is not quite there yet. I think it might be improving. We'll see. But otherwise unscathed. And so I want to use my platforms, my presence online on YouTube and on Instagram and on Facebook and elsewhere to help to share that message. So if you would you share this? Would you click the button below and share? And if you're on YouTube, would you hit subscribe so that you don't miss any future episodes where I talk about this and talk about what others are facing? I think that there's a lot that we can learn from the experience of those in the trenches that go through it, those that have a mild course, those that are asymptomatic, those that have a severe course. And I want to shed light on that so that you know, as you go into fall and winter, what it's like and how it feels to go through it, not just from a physical symptom standpoint, but how it feels emotionally and all the turmoil and everything that goes along with that. All that being said, please wear a mask. It's so easy. Our kids can do it. There's no reason that adults cannot wear a mask. Please distance. Please make the difficult decisions about seeing loved ones this holiday season. It's going to be really hard, but what you're going to say is, We love you. We would love to see you, but we want to keep you safe. We want to keep our loved ones that are at higher risk safe. We want to keep our community safe. And so we're going to make those difficult decisions to keep gathering small, to stay socially distanced, to stay outside if we're able to, although winter is approaching and most places in the United States can't easily accommodate all outside sorts of gatherings. And please get your flu vaccine, because we know that having this dark period in the pandemic where we're going into flu season and we have an out of control pandemic is going to be really hard. So do what you can. Wear a mask, socially distance. If you're sick, get tested. If you're sick, isolate from others until you have that test result back. Follow the directions of your local health department. Get a flu vaccine and give each other grace, because it's not easy and everybody's going through this and it's hard on everybody, even those that don't think it's real, even those that are choosing not to do those easy measures. It is hard for everybody. So give grace and realize that this is not easy. This is not something that we've been through before. It's in this, in the last 100 years. But we can get through it. We can make those difficult decisions. We can make the sacrifices so that we can move through this. Keep up the good work.